Distinguished guests, ladies and gentlemen, dear EBS friends, welcome. Welcome to the first European Health Summit. 2 weeks after a very successful celebration of the 20th anniversary of our annual flagship event, the European Business Summit, I'm very pleased to launch this new platform of debate and exchange, the European Health Summit, on one of the most important topics of today, healthcare, and the way we can improve its organization at the European level, if not at the global scale. This summit comes at a very timely moment, but I would like to emphasize that we started the preparation of the summit 1 year ago, at a time when we could not yet imagine the importance of the question of the European healthcare coordination, the capacity of the EU to provide response mechanisms in case of emergency, or even the importance of public-private partnerships to develop vaccines. All these key issues will of course be at the center of the conference today. However, this is not only a COVID summit. Besides these important, urgent issues, we'll touch upon other topics that the pandemic emphasized and perhaps accelerated. The consequences of the enormous transformation that digitalization and innovation bring to the healthcare systems. We shall discuss in particular 5 main topics. The digital transformation can be a real enabler to maintain accessible and quality health systems across Europe. We need to unlock the full potential of this transformation while at the same time keeping in mind the ethical and deeply human dimension of medicine. How to make healthcare financially sustainable when healthcare costs have outgrown economic growth for decades. How to develop innovative medicine, which will work as a preventive measure and thus be more centered around the patient. How to improve the trust deficit that many feel towards new health data ecosystem. This is of course an existential requirement in order to integrate the new sources of data, capabilities and stakeholders. And last but not least, it was very important for us to include a session on mental health. Mental health is often overlooked, but the pandemic has shown that to what extent it is a key component of individual well-being when it comes to healthcare professionals and citizens in general. Science and technology offer new venues for innovation in this sector, and the European agenda for mental health could mark an important milestone. I'm very pleased to announce that Her Majesty the Queen of the Belgians will join us during these sessions to share her views and insights as an advocate for the United Nations Sustainable Development Goals program. Ladies and gentlemen, if this is not only a COVID summit, it's not only a summit either. This conference is indeed the kick-off event of a new task force dedicated to the European Health Union. Through an ambitious program of conferences, live debates and working group meetings, the EBS will convene EU policymakers, national authorities and regulators, industry representatives, academics and civil society to discuss the priorities of the new health union. And this in order to foster an efficient public-private cooperation and propose concrete ideas and policy recommendations. I would therefore like to thank all the exceptional speakers who accepted to share their views and insights today and who support the launch of this new task force, but also our excellent moderators as well as our partners. In particular, I would like to thank Professor Michel Goldman, founder and co-director of the I3H Institute, who has been of great support as a key knowledge partner to develop the conference's program and to gather today the best experts of Europe, in particular for the session on vaccination and public-private partnerships. As to officially launch the summit, I would like now to invite the President of the European Commission, Mrs. Ursula von der Leyen, for her special address.
Thank you for the European Business Summit, for organizing this important gathering. Distinguished guests, ladies and gentlemen, I am a medical doctor by training, and I have always been proud of Europe's health systems. They are among the best in the world. Yet the challenge of this pandemic is unprecedented in modern times. We now know that defeating this virus is possible, but no country and no government can defeat this virus alone. This is true, first of all, at the global level, secondly, inside Europe, and thirdly, between the public and the private sectors. Let me focus first on our response to the pandemic. The European Union has taken the lead to convene a global response to COVID-19 and not only a national one. For this purpose, we not only work with WHO and the G20, but also with civil society and foundations and other private players. Our common goal is to finance the development of vaccines, tests and treatments for the whole world. We so far raised 16 billion euros. We also joined and contributed to the COVAX facility to ensure that newly developed vaccines are also available for low and middle income countries. Team Europe alone has provided 800 million euros. And this is the largest donation to COVAX worldwide. Why have we done that? Because we are convinced that we will only defeat the virus if we defeat it all around the world. Secondly, we have established an unprecedented cooperation inside Europe on health issues. In November, we have taken the first steps to establish a European Health Union. We will now have an EU-wide preparedness and response plan. This will help us harmonize national plans, including audits and stress tests by the European Commission. We want to make it possible to declare, if necessary, a state of EU health emergency. And this would trigger greater coordination among member states. It would trigger joint procurement of medical equipment and, for example, the deployment of EU outbreak assistance teams. To better support member states, we also propose to give more responsibilities, and thus powers and resources, to our existing European agencies. The European Centre for Disease Prevention and Control, ECDC, and the European Medicines Agency, EMA. To improve our forecast, we will create a new agency, the European Health Emergency Preparedness and Response Authority. It's a very long name. We call it HERA. HERA will focus on next crisis and, if possible, avert them. So HERA will work with all the relevant players, from conception to deployment of therapies, vaccines and technologies. This kind of cooperation is essential to a rapid response in the event of a health emergency. Governments alone cannot end this pandemic, and that's why the Commission presented last week its pharmaceutical strategy. It is about creating win-win situations with the private sector. But we also want to put patients at the center of medicine's development and supply. And thus, we will be working with innovative small companies as well as large multinationals in Europe. Europe can take the lead in supplying groundbreaking medicines that are also affordable and widely available. These are three cornerstones of our new health policy, and we will continue to build the health union in the coming months with our Beating Cancer plan and the European Health Data Space, together with global partners, together with all Europeans, and together with the private sector, only together will we be able to address the biggest challenges for global health. And this leads me to the last point. As one expert at Johns Hopkins put it, vaccines don't save lives. Vaccinations do. The development of vaccines has been a remarkable team effort. But we will need an even greater effort to deliver them to every village of this world. And we have to prove the safety and the efficacy of those vaccines, especially in the face of growing vaccine skepticism and disinformation campaigns. And the message is clear. Vaccination is about self-protection and solidarity. Dear guests of the European Health Summit, we have to build strong and trustworthy narratives. And this is possible because together we have made unprecedented progress in the area of vaccines, and this is the result of joint cooperation. I count on your further support. Thank you.
Thank you so much, President von der Leyen, for sharing with us the key aspects of the European Health Union and also for announcing the creation of the new HERA agency. As you emphasize, we strongly believe in building a collective intelligence in the public and private sector. You can count on us to support this new European Health Union, which is exactly the objective of our new task force. So thank you again for your participation today, dear President. Let's now move back to the studio and to Maria Tadeo to launch the opening conversation of this summit.